Doctor of the day basically just means a rotating schedule for a physician who provides coverage for that day. So in this case, a doctor of the day will be present or on call or working that day, but it may be provided, the service may be covered by somebody different the following day. The virtual Doctor of the Day service works by the client or community member phoning a 1-800 number and connecting with a medical office assistant. That office assistant will then book an appointment with the physician and the client, either by telephone or over the computer or a laptop or tablet, to be able to connect sort of face-to-face virtually. For the most part, family physicians cover all types of appointments with people. We're general practitioners. And if people call into the virtual Doctor of the Day service, they can talk about any sort of medical care issue that they may have. What we can do is we can provide counseling. We can review signs and symptoms or concerns that the patient may have. If we determine that prescriptions are needed, those can be ordered. If lab work or imaging is also required, we can also help arrange that. What we can't do is a physical examination. We can't actually physically touch the patient to do a sort of exam. But in some cases, if doing it virtually and through a screen, sometimes we can actually view something. If somebody has a lump or a rash or something like that, we may be able to sort of work around that a bit. The virtual Doctor of the Day service. So in the hiring of the physicians who are covering or have been hired to work, we have a selection committee and a process where we really try to focus on either those who have Indigenous ancestry or lived experience themselves, or those who have experience with cultural safety and humility. A lot of the members have experience having worked in rural communities, which many of our community members might be calling in from. So you need to have a bit of a unique perspective or an appreciation of some of the environments and the situations from those who have diverse backgrounds and diverse living situations around the province to help create a program that sort of comes to help meet the needs of the people who are on the other end of the phone or on the other side of the screen. It's at no charge. And the physicians, the way that it sort of works in the contract, they're allowed to be flexible with the time and not feel like they have to rush through an appointment. So we're able to spend hopefully what is adequate time to kind of get through a patient encounter so that we reach some sort of agreeable sort of end line. In this case, we're hearing a lot of community members, particularly in rural communities, who are unattached or not already seeing or have access to a primary care provider, having a heightened need to be able to connect with somebody for ongoing medical care services or new medical care services that come up.